All right, I'm at the nurse's station getting ready to perform my second med check. So I have Ferdinand Foley in room 214, date of birth 9/23/69. Mr. Foley has no allergies. He has Humulin R 8 units sub-Q to be given right now, ordered. So I have my Humulin R right here, and it has an expiration date of March of 26, so it's still within its expiration date. It's good to use. So I'm going to go ahead and draw that up. So first thing I'm going to do is get my alcohol wipe. I'm going to scrub the top. Since this is not a long-acting insulin, I do not need to roll or agitate the vial. While I'm letting that top kind of dry, I'm going to go ahead and uncap my needle, and I'm going to aspirate 8 units of air, since that's his dose that he's going to be giving. So I have my 8 units drawn up. I'm going to go ahead and put my needle in here, making sure that it's not touching the medicine, and it's not, and I'm going to push my air in. Now I'm going to invert my vial, and I'm going to draw back my 8 units of Humulin R. Sorry, hang on, it's slipping out of my hands. 6, 7, 8. There are no air bubbles in there. If there was, I would make sure to kind of tap those out. I'm going to pull my needle out. I'm going to go ahead and recap it using the one-handed method. And I've got that. All right, and I have my 8 units right here. So now that I have drawn this up, I'm going to go ahead and grab a second nurse, and I'm going to have her verify this with me. So I have my Humulin R insulin that is ordered, and he has ordered 8 units. So I have my 8 units drawn up right here. There's the 10 mark, and it's right there, my 8 units. So my second nurse said everything looks good, so I'm going to go ahead and create my label real quick. So I'm going to write on here that we have Humulin R, 8 units he's have it ordered to be given now, which is 1,500, today's date, which is 3/10 of 25, and my initials. And I'm going to go ahead, and just bring that right here. All right, since this is a multi-dose vial, it won't go to the patient's room, so I'm going to go ahead and perform my third med check real quick. So I have Ferdinand Foley, date of birth 9/23/69. Mr. Foley has no allergies. His physician ordered that he receive Humulin R 8 units sub-Q for right now, which is 1,500. We have our Humulin R. It has an expiration date of March of 26, so it's within its expiration date. He had ordered 8 units, and I had went ahead and already drawn up my 8 units. So I'm going to go ahead and put this back in the Pyxis and kind of discard of any trash that I have. And since I've done that, I'm going to go ahead and write down my time on my MAR here for 1,500, and I'm going to write my initials next to it, saying that I prepared it. So now we're okay to go ahead and go to Mr. Foley's room and go ahead and administer this. So I'm knocking on my patient's door. Knock, knock, knock. Hand hygiene. Good afternoon, Mr. Foley. My name is Samantha. I'm here to give your insulin this afternoon. Can you tell me your name and date of birth for me, please? Ferdinand Foley, 9/23/69. That matches my MAR, matches his bracelet, so we're good there. And then, Mr. Foley, do you have any allergies? No, he does not. Matches his allergy bracelet, matches my MAR right here. So now I'm going to go ahead and scan his bracelet. Beep. And I'm going to go ahead and scan my label that I created for my insulin. Beep. All right. Now that I have these ready to go, I'm going to go ahead and put my gloves on. All right, with my gloves on, I am going to select a site to administer his insulin. So with a sub-Q injection, they can be given in the outer aspect of the upper arm, the 2 inches away from the umbilicus, in the abdomen, the anterior thigh, or the scapular area of the upper back, or the ventral gluteal area. For Mr. Foley, he has requested that I do his abdomen, so I am going to do 2 inches away from his umbilicus. So I have that right here. I'm going to take my alcohol swab, and I'm going to kind of start, and I'm going to clean it in a circular motion going 1 to 2 inches out. So now that we've got that, while that's drying, I'm going to go ahead and take my needle cap off. I'm going to pinch the skin up right here. And with my dominant hand, I have my syringe. And since Mr. Foley has a little bit of extra skin, I'm going to go ahead and insert this at a 90-degree angle. I'm going to slowly administer my medication. I'm going to hold it for 10 seconds. And then I'm going to go ahead and pull my needle out. And I'm going to release that skin, and I'm going to grab a 2x2 and just kind of apply some gentle pressure. At this point, I would go ahead and my needle does not have a safety device, so I'm going to cap it using the one-hand fishing method. And I will go ahead and put this in the sharps container right over here. Now that I have that discarded, I'm going to go ahead and take my gloves off. I'm going to perform hand hygiene. I'm going to ensure that Mr. Foley has no other needs that need to be met at this time, and he does not. So I'm going to make sure his bed is in a low locked position with both side rails up, call light within reach. And I'm going to go ahead and mark through my time here, stating that I have given it, and I'm going to write that I gave it in the abdomen. Abdomen 2 inches away from umbilicus. And we'll put, we'll do left side. And here's my MAR right here. I have it signed, initialed, and then I have my time right here, just stating where I gave it. And that is time.